Hi, this is Dr. Soraya, and making a video as part of my series of psychiatrist comments on Psych Meds. If you haven't listened to the disclaimer video, please do that before proceeding. This week I decided to just do a general video about psychiatric medications because a lot of the comments that I'm getting on my videos are of the nature of people sharing their individual experiences, and I think that's perfectly okay, but I also want to remind people that the point of these videos and the point of psychiatric medications and the option of considering them, it's not meant to be a one-size-fits-all a situation. So in describing the benefits or the downsides of any medication, the idea is that that's information to integrate as part of one's decision, but a particular anecdote isn't that useful in appreciating the possible benefits or the possible risks of a particular medication. And this is why I think consultation with a psychiatrist and a one-on-one evaluation with a psychiatrist is so specifically valuable, because that's where you get into the nitty-gritty of what the likelihood is of various benefits and various side effects. So for all of you who have had a bad experience with psychiatric medications, I'm certainly sorry to hear that, and I think it's perfectly reasonable that you clearly don't want to take a medication like that or anything similar to that, and why you'd be leery about psychiatric medications in general. But again, there are many people who have benefited tremendously from finding the right medication. So I hope that you would understand that it's still reasonable for people to consider a trial of medications to see what their experience would be, because in particular in the hands of a psychiatrist, psychiatric medications have a very good track record of benefit, and side effects can be minimal to none, or if they're present they can be mitigated with dose adjustments, with timing, with other interventions, and in some cases, although it's not my favorite strategy, with an additional medication. But sometimes the benefit from the first medication is so significant that patients are willing to take on a second medication to deal with the side effects, because on balance it's such a net positive for them in their experience. So that's really all I wanted to comment on today, which is that generally speaking, psychiatric medications are an option worth considering. It's really best done with a psychiatrist, which I understand not everybody has access to. But if you do have the option of being evaluated by a psychiatrist to consider psychiatric medications, I think in the vast majority of the cases it's going to be worth your time. And keep in mind that that consultation is not necessarily a decision to try a medication. It's an opportunity to get more information to find out if medications might make sense for your situation. Okay, thanks.